1-stage distal hypospadias repair, with or without chordee or circumcision, with simple meatal advancement, e.g., magpie, V-flap. The physician corrects and repairs a chordee, which is an abnormal curvature of the penis. The physician also prepares the penis for correction of hypospadias, an abnormal opening of the urethra on the underside of the penis or on the perineum. The physician corrects hypospadias in the distal penis at the base of the head of the penis in a 1-stage procedure. An incision is made around the shaft of the penis next to the glans, head, and the skin is dissected from the penile shaft, taking care to avoid injury to the urethra. An erection is artificially produced to evaluate any chordee before and after the correction. Any chordee present is corrected by excising the responsible fibrous band. A second incision is made in the groove on the underside of the glans. Skin in the area is pulled up to the glans and fashioned into an opening by suturing in the head of the penis. A circumcision, or excision of some foreskin, may be performed. The original incision around the penis is closed by suturing. One-stage distal hypospadias repair, with or without chordee or circumcision, with urethroplasty by local skin flaps and mobilization of urethra. With extensive dissection to correct chordee and urethroplasty with local skin flaps, skin graft patch, and / or island flap. One-stage proximal penile or penoscrotal hypospadias repair requiring extensive dissection to correct chordee and urethroplasty by use of skin graft tube and / or island flap. One-stage perineal hypospadias repair requiring extensive dissection to correct chordee and urethroplasty by use of skin graft tube and / or island flap. The physician corrects hypospadias of the penis in a 1-stage procedure. An incision is made on the ventral surface of the penis and around the urethral opening. An erection is artificially produced to evaluate the chordee before and after the correction. Chordee is corrected by excising the responsible fibrous band. Considerable dissection is required to mobilize the urethra. An island flap of skin is created from the foreskin and sutured together to form a tube to be used as a segment of urethra. This formed urethral tube flap is sutured in place between the urethral opening at the base of the shaft of the penis and an opening created in the head of the penis. The foreskin and skin overlying the shaft are further divided and dissected free and sutured over the defect left by the flap on the ventral surface of the penis. A circumcision is usually the result of the procedure. Would it be appropriate to report the flap code 15740 in conjunction with code 54328? Since the descriptor of code 54328 states that the hypospadias repair is performed with local skin flaps, skin graft patch, and / or island flap, the island flap would be considered an integral component and would not be reported separately. Therefore, it would not be appropriate to report code 15740 with 54328. Repair of hypospadias complications, i.e., fistula, stricture, diverticula, by closure, incision or excision, simple. Requiring mobilization of skin flaps and urethroplasty with flap or patch graft. Requiring extensive dissection and urethroplasty with flap, patch, or tubed graft, includes urinary diversion. The fistula, abnormal passage, or diverticula, pouch or sac, is identified and excised, often using microsurgical techniques. The defect in the urethra is repaired by closure with a free patch graft or flap graft. The skin defect is closed by simple suturing or by the use of a flap skin graft. A stricture, narrowing, is corrected by dilating the area with dilating catheters or by incision and suture repair. The urine may be diverted through a catheter left in the bladder. The catheter can be passed through the urethra or placed directly in the bladder through the lower abdominal wall just above the pubic bone. Repair of hypospadias cripple requiring extensive dissection and excision of previously constructed structures including re-release of chordee and reconstruction of urethra and penis by use of local skin as grafts and island flaps and skin brought in as flaps or grafts. The physician repairs severe, disabling complications from former hypospadias repairs. Often using microsurgical techniques and considerable excision of scarred and damaged tissues, the deformities and malfunctions of the urethra and penis are corrected. Two or three stages may be necessary to complete this complicated task. A new urethral segment is created with a free patch graft, a flap graft, or by the use of a tube graft. Extensive dissection and mobilization of tissues are generally required to complete the process. Skin defects are closed using flap or free skin grafts. Any strictures are corrected by dilating the area with dilating catheters or by incision and suture repair. Urine may be diverted through a catheter left in the bladder. Repair of component S of a multi-component inflatable penile prosthesis. The physician makes an incision into the corpus cavernosum to inspect the previously placed prosthesis. Repairs are made. The corporotomy is closed by suture. The subcutaneous tissue is closed by suture and a dressing is applied to the incision. The bladder is emptied with a catheter. An indwelling urethral catheter, if used, is removed on the first postoperative day.